I got to the point where I was in severe pain. I couldn't walk. It really impacted my ability to do things that I like play golf.
Got to the point where I really couldn't walk very well, and was limping a lot and dragging my leg, and it was just to the point that pain was and the flexibility got to the point that it was just not bearable.
Sitting, going to a stand was incredibly painful. Had to hold on to something to stand up.
Had to give up tennis a number of years ago because of the problem. So it was something that had just started out small and got progressively worse.
I just got to the point where life was not fun anymore.
A couple of years ago, the hospital identified several areas where we wanted to strategically focus our efforts and our resources. One of those was the joint replacement program, knowing that as the population ages, joint replacement surgery continues to be a viable option for our patients to have good outcomes and be returned to normal function in their life. So we wanted to put a lot of resources into making sure that when the patients come here and make the decision to have their joint replacement at Duke Regional Hospital, they're going to have the best outcomes and a safe discharge from our program.
The nursing care at Durham Regional was excellent. I had great nurses. They'd even come in and just say hello when they had a moment, which was infrequently, but because they were always so busy. Very, very attentive, asked me if I needed anything.
The doctors and the nurses were great, telling me what to expect, and the physical therapists were excellent and didn't have anything that I hadn't had covered prior to the surgery.
All of the people that were involved at some point in that whole process were very professional and I think really cared and helped me, put me at ease with the entire process.
The physical therapists were very, very considerate, very cautious, never asked you to go beyond what you could do, asked you to try to do a little bit more, but if you couldn't, they didn't push you.
I can give nothing but 5 stars to Durham Regional. The care was just exceptional.
There's a joint responsibility, pardon the pun, between the patient and the medical team. And I found it was really important to pay attention to what the medical team asked me to do as a patient.
I would encourage people, again, to follow the PT schedules and work hard at that to get that mobility back, and it will come. You probably will not realize that at the time or just think that'll never happen, but if you persist, it truly will work.
I was given instructions each day. The doctors would come around and hand me a sheet of paper and say, this is what you're expected to do and this is what we're expected to do today.
My role in recovery can't be, underestimated. You have to be motivated, you have to do your exercises, you have to want to have your joint replaced and have it be successful.
Knowing that the more I did, the better off I was going to be. My goal was to get out of the hospital and get home. They knew that, and so they helped me to that end.
One of the things we've really seen since we implemented the program in the last 2 years is the recognition by the patients that the experience is optimal. We've always provided good clinical and quality outcomes, but with the addition of the pre-op teaching and seeing that the team is working as a whole to achieve that goal with the patient, we've really had a barrage of letters, comments on our patient satisfaction surveys that really reflect the fact that the patients and their families are recognizing that we're working as a team to achieve their goals and are very highly satisfied with their experience.
Having an attitude of being an athlete almost in dedication to your recovery. So following the doctor's instructions, going to physical therapy, doing your exercises, and that positive attitude, I think, really contributes to getting better. It's way too easy to just lay still and not want to get up and move, and that's critical to your recovery.
Well, the physical therapist came to my room and said, okay, are you ready for your walk up the stairs? And she took me into the hospital stairwell which is a full flight of cement steps, and showed me the correct way to walk, the way to use the crutches, and the way to get back up again. And then she looked at me at the end and said, "Okay, go home." And I did. And I never looked back.
As far as being out playing golf and some of the other activities that I was hoping to be able to do, I have been able to as my time has allowed, I have played a fair amount of golf on and off with some of my golf friends, and at least my knee has not been an issue like it was at one time, and I think it actually improved my golf game, so that's great.
Bingo! Bingo! First one, have to practice.
3 major goals in mind when it came to my final knee replacement. They were, first, to be able to play golf again, and I did. Just a few months after my second knee replacement, I played golf, and of course I had to beat my husband. That was important.